Hi folks, we're at Stonebridge Animal Hospital. I'm going to kind of give you a guided tour of how you bring your animal in and what we expect for you to do and everything like that during that aspect. We love all the animals that we have here and come in. And the most important thing, first off, we need a weight on your dog. And we have a weight chart here. We want to make sure that your dog is not overweight or underweight in that aspect. So it's very important to get the weight first. And then you would start from their aspect. We get the weight on your dog, and then you go over here and you check in. And this is Rachel, one of our main assistants, and she helps us with everything. All of my assistants do almost everything with me. They're surgical assistants. They help me in the rooms. They do lab work. We train them to do everything here at our clinic. You have to sign in. You have to fill out a chart. We'll have a chart for you to fill out your information, and once we get that done, then we'll take you into a room and do your examination on your dog or cat and explain everything or whatever you need in that aspect. These are the three, got three exam rooms. Room number one, I'm going to swing the door open. You can kind of peek in there if you like and kind of see what it looks like. We try to keep it disinfected and clean it the best way we can, and we clean them up after each animal. The next room, all the rooms are about similar. They're a little bit different in size, but they're very similar. And we'll just go through here, and the other room is similar also. We have things and charts on the wall to indicate, that helps me demonstrate the different kinds of things to explain to. Talks about stones, we talk about ear infections, talk about arthritic problems, patellar luxation situations, different kinds of flea and tick and heartworm preventative. Talks about kidneys and kidney diseases and oral care and the dentals here. These are charts as far as indicating how bad the infection cat can get around the gums. And we explain that to you, and it's very, very important to look at these and understand what they need, because they can cause lots of problems and situations. Before we get started, let's say you brought your dog in for a dental or a surgical procedure. If your dog was 2 years of age or older, you would be required to do an EKG. The EKG is a small apparatus, and we fit it into our computer. It's held up to the side of the dog. It's a lead 2 EKG, and it gets the information. It's a little bit different to what you see in human medicine, but it is extremely good. Gives you a lead 2 EKG, which is the most important one, and gives us lots of information if your dog or cat might have a problem. I really think that this instrument is one of my best instruments I have, and then we put it infraredly into the computer. Basically, we just press this little button, and we hold it away from this, and it beeps it into there, and it will light up if it's transferring, which it's not right now. So, but that's it, and it prints my EKG out. This is our dry chem. It's made by Heska, and we do all our chemistries here. We do send some of them out depending on what we need, but we do a lot of them here at our clinic. We're a full-service hospital. We have all the vaccines necessary. This is for CBC and hematocrits, and then we keep everything, we print them out on a sheet that is put into your file what you really need. We'll go this way again. This gets into our back area where we actually treat the animals. Sorry we're just a little busy today. Sorry for the conclusion. But we try to keep it as clean as possible. What you're seeing now is our surgery suite area, and also we do dentals here in this little sink area. This is nice, and we pad this so that the animals are nice and comfortable when we do the dentals. We have a dental machine, a Cavitron over there, that is for our dentals, full service on that aspect. And the surgery area is, of course, we have good lighting, I need that, and the anesthetic machine, the gas anesthesia, and the endotracheal tubes, and everything that's necessary for the surgery. So this is the area. We do our parasitic checks over there with a microscope. Over there where the lid's covered over, I'll pull that cover off there. And we keep record of all those sticks, and it's also put into your file. So we have a full service hospital. One of the things we don't do is we don't board. We hospitalize animals. We have about 12 cages here that we can house our animals, and there's Rocky again over there in the cage, in the far cage over there, for the hospitalization for a problem or anything like that, but we don't usually board the animals. I found it not very good for most veterinarians not to board, because sometimes they get not taken care of as well as with people that actually are in that business for the situation. So it's just my pet conversation with that, and some veterinarians might not like me saying that, but I just think it's not a good thing for veterinarians to have a boarding facility in a clinic. This is a hospital, not a boarding facility. We'll walk right over here. This is where we take our x-rays. This is an older machine, but it works very, very fine. And we've got the table here where we put the animals. Got either Bucky or non-Bucky situation with that. That's it pretty well in a nutshell as far as a tour of the clinic. Hope you enjoyed it. Talk to you later.